Welcome to this video, where we dive into the beautiful and important journey of breastfeeding. Whether you're a new mother or preparing for your baby's arrival, understanding how to breastfeed correctly and confidently can make a huge difference. In this 4K video, we'll cover everything you need to know, from the first latch to expert tips that can make your experience smoother and more rewarding. Breastfeeding is more than just feeding, it's bonding, comforting, and nourishing your baby in the most natural way. Breast milk is perfectly designed for your baby. It contains the right mix of fat, protein, vitamins, and antibodies to support growth and immunity. It's always available, always the right temperature, and adapts as your baby grows. Let's begin with the basics. How to get started. Right after birth, it's ideal to initiate breastfeeding within the first hour. This is when your baby is most alert and instinctively ready to feed. That early contact helps regulate their body temperature, heart rate, and breathing, while also kickstarting your milk production. Now, positioning and latching are two of the most important things to get right. A good latch ensures your baby gets enough milk and prevents nipple pain. Hold your baby close, belly to belly, with their nose opposite your nipple. When their mouth opens wide, bring them to the breast, aiming the nipple toward the roof of their mouth. Their chin should touch your breast, and their lips should be flanged outward like a fish. You'll feel tugging, not pinching. If it hurts, gently break the latch with your finger and try again. There are several breastfeeding positions you can try. The cradle hold is common, with your baby resting in your arm. The cross cradle gives you more control, especially helpful for newborns. The football hold is great for moms who had a cesarean or have larger breasts. Side lying is useful for nighttime feeds. Experiment to find what's most comfortable for you and your baby. During the first few weeks, your baby will likely feed every 2 to 3 hours, including overnight. That's about 8 to 12 times in 24 hours. Don't watch the clock, watch your baby. Signs of hunger include smacking lips, sucking on hands, or turning toward your chest. Crying is a late sign, so try to catch the early cues. Feed on demand to establish a strong milk supply. It's completely normal to feel some nipple tenderness at first, especially in the early days. But if you're feeling sharp pain, cracks, or blisters, it may be a sign of an incorrect latch or other issue. In those cases, consider getting help from a lactation consultant. They can assess your latch, your baby's mouth position, and provide personalized solutions. One common concern among mothers is milk supply. How do you know if your baby is getting enough? Here's what to look for. Steady weight gain, at least 6 wet diapers a day after the first week, and regular soft bowel movements. If these signs are there, your baby is likely getting plenty of milk, even if it's hard to tell just by watching them nurse. Staying hydrated is key. Keep a bottle of water nearby while you nurse, and drink throughout the day. Eating nutritious meals with a balance of fruits, vegetables, whole grains, and protein supports milk production and keeps you energized. Breastfeeding burns extra calories, so don't skip meals or ignore hunger. Breast fullness and engorgement can happen when your milk comes in. Your breasts may feel heavy, hard, and uncomfortable. Feed your baby frequently to relieve pressure. You can also hand express a little milk or use a pump if needed. Warm compresses before feeding and cold compresses afterward can also help reduce swelling and soothe discomfort. Sometimes, babies may cluster feed, nursing more frequently during growth spurts. This is totally normal and helps increase your milk supply to meet their growing needs. It can be exhausting, so try to rest when your baby rests and get support from your partner or family. Burping your baby after feeding is another helpful habit. Hold them upright against your chest and gently pat or rub their back. It helps release any swallowed air and prevents discomfort. If you need or choose to pump breast milk, make sure to use a clean and well-maintained breast pump. Store milk in labeled containers with the date and time. Fresh milk can stay at room temperature for 4 hours, in the refrigerator for up to 4 days, and in the freezer for 6 months or more. Always thaw frozen milk slowly in the fridge or under warm water, never in the microwave. Public breastfeeding is your legal right in many places, but it can feel awkward at first. Wear loose, comfortable clothes or nursing tops, and use a nursing cover if that helps you feel more at ease. With practice, you'll feel more confident feeding your baby anywhere. Don't forget to care for your mental and emotional well-being. Breastfeeding can be demanding. Some moms feel overwhelmed, especially when dealing with sleep deprivation and hormonal shifts. It's okay to ask for help. Join a breastfeeding support group, talk to other moms, or speak to a professional if you're feeling down or anxious. Remember, every mom and baby is different. What works for one person may not work for another, and that's perfectly okay. Some moms breastfeed exclusively, others pump, and some combine breast and formula feeding. What matters most is that your baby is fed, loved, and growing. Finally, enjoy the bonding time. Those quiet moments of eye contact, skin-to-skin closeness, and the peaceful rhythm of nursing create lasting memories and emotional security for your baby. Take each feed as a chance to connect and build trust. Thanks for watching this in-depth 4K breastfeeding guide. We hope these tips give you confidence and support as you nourish your baby. If this video helped you, don't forget to like, share, and subscribe for more helpful parenting content. You're doing an amazing job. Trust yourself, trust your baby, and take it one day at a time. See you in the next video.